going to do a peek at the belly. Nice and soft. Can you feel this sensory perception? Do you feel that there? In here? Very good. Scratching up by the face, also not noting any abnormality there. All right, Mr. Wayne, we are going to go ahead and get started with your head to tail ELF examination today. Now, I spoke with Santa and he said you guys will be headed for your trip very soon, and we want to make sure that all systems are a go. So I very much appreciate your cooperation today. This examination shouldn't take very long, but I do need to ensure that I have kind of a thorough inspection, make sure that all functions are acting appropriately and that there's nothing of concern, nothing that would delay your mission. Okay? All right. All right, so as you know, you will be traveling outside of the North Pole. It is very important that you have a coat that is thick and adequate at maintaining warmth. So just having an overall look at the variation of hair texture and pattern here, I do see some lighter areas as well as some darker areas and some striping and variation there. I'm not noting any signs of abnormal alopecia. There's nothing that looks sparse or like there are areas of hair missing, which is a really good sign. I do want to go ahead and just make sure there's nothing particularly concerning happening with temperature variation. It is really important to test different areas here. So I'm going to test at the head as well as the hindquarters. And so far getting an average temperature of about 96.3, which is perfectly acceptable. Slightly warmer here at the face, which is really to be expected. So your temperature variation looks okay. So I have a little wand here. I'm going to do a little test of your eyes, check for pupillary coordination, ensure that there's nothing concerning happening here. So I'm going to have you just follow this for me. Very good. And here. Very good. Very good hand-eye coordination. And again. Doing very well with that. You are able to keep your eye on it appropriately, and I see that hand-eye coordination is intact. Okay. All right. Very good there. So I'm just going to do a bit of a palpation assessment here, Bruce. I'm going to palpate around your scalp. Feel for any abnormalities of the cranium, anything that could feel abnormal around the ears. Of course, the neck is very important that there are no abnormalities along the spine as I palpate down. Tail is nice and straight. Let's go ahead and do a measurement here for abnormal curvature, which is symmetrical there at the abdomen, not noting any abnormalities there. I'm going to go ahead and check here at the neck. Okay, and then I just want to measure. Very good. Okay, all right. So I'm just going to do a quick stethoscope inspection, if that's all right with you. I just need to listen for any abnormalities of the heart and the lungs, Mr. Wayne. So I'm just going to listen here. Very good. Very strong. Nice and symmetrical. I would say adequate bowel sounds. I do hear some movement. That upper GI tract indicates healthy digestion. Listening at the lower abdomen as well. Very good. Just going to do a quick lung auscultation. Good, so just listening for symmetry here. No signs of abnormality. Very good, nice and healthy. Now if you take a deep breath for me, Bruce. Deep breath in. Good, let's do that one more time. Deep breath in. Very good, okay, very good. Heart and lungs sound great. Santa will be happy to hear that there are no questionable variations there. So just also going to have a look at symmetry, overall bone structure here, the back feet versus the front paws. That does look okay. Nice and wide stance here, able to help keep you level. Just have a quick look at your face. Very handsome. Whiskers are intact. Eyes are nice and clear. Very good. So just have you flip over here, Bruce, so I can have a look at this other side. Thank you for your cooperation. And just having a look here as well. The limbs, nice and strong. Just going to have you push down here, Bruce, just checking. Good. Very good strength and accommodation there. Check that at the face as well. I would say straight. No, it's about even there. It was stronger on the first go, but you did better that second time. Your ears are very nice. Airplane activated. All of that seems to be working. So just having a quick peek at this side as well. Do notice just a little bit of shedding, which was noticed at your last visit as well. And just going to do a peek at the belly. Nice and soft. Good job. Okay. So I'm just going to go ahead and obtain a few measurements as well. So front paw. It's fairly symmetrical there, about 6.5 on each side. And back paw, we're at about 5. Slight variation there, about 5 1/4 on that side, but that's okay. And if we measure distance of the ears, okay, 3.5 inches there. Quite rotund at about 10.5 inches at the diameter. And just measure. Okay. Just need a couple of measurements for your angles here, Bruce. I want to ensure that we have adequate measurements. Make sure your elf costume fits appropriately and safely, that your harness is nice and secure. Just doing a couple base measurements around your bone structure, particularly at the scapula. All of that looks okay. And maybe adjust about 1/4 inch there. Okay. All right, Bruce, if I could have you just come a little bit closer here for me. Perfect. It's very much appreciated. I'm just going to just have a look at you here. I'm going to do a bit of a posture assessment. So where you are going to be seated in the sleigh is quite rigid, and I just want to ensure there's no abnormal curvature of the spine here. So very good. So I do see a slight curve here actually. Looks like you just prefer to lean towards that left side. Yeah. So in the sleigh, you might have to accommodate slightly here and just try to remain midline, but there should be just a little bit of room for wiggling there. Rudolph, leave the light alone, please. Santa will not be pleased. Okay, so I'm just going to test your pupillary reflex, and as I bring this closer to your face, I am noting just a slight delay in reactivity, picking up just a little bit now. Those first initial points were slightly concerning though, as you almost seem to not react at all. Again, just a slight delay in reactivity there. Interesting. Okay, all right. Bruce, I'd like you to say yes when the paw touches you, just testing for sensory variation here. So, can you feel this sensory perception? Do you feel that there? In here? Do you feel this here? On the abdomen, does that all feel the same? Do you feel any less on this side than you do on this side? Does that feel different to you at all? In the feet, does that feel about the same? Front paws as well? Okay, perfect. So just got scratching tool here, and I'm just going to very gently rake over the fur, checking for any signs of thinning. Also provides a nice sort of sensory stimulation, so just very gentle stroking of the fur, very mild. Good. Fur is very cooperative, nice and soft, not noticing any coarseness. Does appear as if you like your belly scratched. Very good. Scratching up by the face, also not noting any abnormality there. Just a very good sign. Apply a light amount of pressure with my hands here, Bruce. I want you to just let me know if any of this is tender. So just doing a bit of a deeper palpation along the organs. Feeling around for any signs of tenderness or edema, which is so far not notable. And at the hip bone, nothing there as well. That's very good. Okay. All right, just checking along the eyes once more. Nothing particularly concerning there. And I'm just going to have you sit up here for just a second, Bruce. I want to just have a look at your upright posture, ability to maintain a seated position. Just having a couple of palpations of your neck, feeling around the lymph nodes. We certainly don't want to infect any of the other elves, so just making sure that there are no signs of swelling or edema here. Just not notable. Have you swallow for me, Bruce? Very good. Nice and even there. Again, ears are very reactive, which is very good. And ability to maintain upright posture, I would say, could be worked on a little bit, but you're doing a very good job overall. And I would say as a whole, that can probably conclude your examination today, Bruce. I do believe we checked everything quite thoroughly. Santa will be pleased with the outcome. So I will go ahead and get all of this documented in your ELF chart, and I will send that over in your portal so that he can look at it and get you checked off for your upcoming trip. All right, well, thank you so much, and I hope you exit the North Pole safely.